Hello, I'm Dr. Annalene Weston, Dentolegal Consultant at Dental Protection. Welcome to RiskMatters, our latest series of podcasts created specifically for dental practitioners in Australia. As the name suggests, RiskMatters is all about managing risk, and in this podcast series, we'll be taking your feedback and queries and putting them to leading industry experts, getting them to answer the difficult questions about managing risk and working safely. It's all about what to do when managing risk matters most. So in this edition, I'm absolutely delighted to be speaking with Professor in Occupational Psychology, Joe Yarker, and occupational psychologist, Marleen Reinke, about some recently completed research that they undertook in conjunction with the MPS Foundation. Now, for those of you who are unfamiliar with the MPS Foundation, it's a global, not-for-profit research initiative dedicated to improving patient safety, reducing risk, and enhancing the well-being of all healthcare professionals. Through our foundation, we at MPS and Dental Protection support research relevant to public and private healthcare in both primary and secondary care settings, outpatient practices and dental care. We are committed to investing in research, analysis, education and training. So thank you both for joining me today, and I'm so very excited to have you both on board to talk about your research about a subject which is really very, very close to my heart. So thanks, guys. Starting from the beginning, and I don't know who wants to take which question, I'll let you decide. Could you please outline what your research set out to explore?
Absolutely. So thank you so much for having us here as well. It's so great to be able to share our research. And one of the things that, as you've been talking about a lot, is that we know that so many dentists and those that are on their journey to dentistry experience burnout. The stress of work is significant. And there's been a lot of talk and a lot of sharing of experience of those outcomes, what happens when people are really suffering from all the things that are going on, whether that be at work or the pressures of life as well. And one of the things that we see in other sectors is that there's actually quite a lot that is being done to understand what's going on at work, and how can we take action to prevent some of those stresses, those hazards that are in the design and the management of work. But when we looked at the research in dentistry, compared to some other sectors and some other healthcare sectors, there hasn't been so much research. So what we really wanted to do was to remedy that. And so this project, which was focused on thriving at work, really looked to understand what is needed to protect and promote the personal and professional well-being of dental clinicians that are working across practice. And so our specific research questions were to look at what the work-related risks are experienced by the dental practitioners, and what impact do they have on health and well-being, patient safety, and organizational performance of the dental practice. And also, what are the similarities and differences in the risks experienced by practitioners working in different geographical locations? And what is the relationship between the work-related risks and the mental health and reported outcomes of those professionals? Because then what we can do is, instead of talking about the fact that work is stressful as this big blob, which often I think people do, we can then start to really identify, well, what about work is problematic, and how do we then start to take action to really improve the way that work is done? We also wanted to understand what support is available. So who's accessing what support is seen to be helpful, and also what are the barriers to accessing support, so that we can think about how do we design better, more effective, more available interventions and activities to support dental professionals' well-being.
That's fantastic. And thank you for giving me such a comprehensive overview. And I'm listening to you and I'm thinking tick, 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 because yeah, absolutely. I agree. And I think it's something which has been reasonably well researched in some sectors of healthcare, perhaps hospital-based clinicians, for example, where they've got a captive group, but it's not necessarily something, because I believe your focus was predominantly on private clinicians. Is that correct? Yeah, I can't think of anything else that was, if you see what I mean. Yeah, so that's fantastic. So what were the key findings then that emerged from your study? Because it looks like you were looking at some really broad things.
Yes, that's right. And maybe just to describe a little bit how we went about the research and what the methodology was that we applied might be helpful just to kind of build a picture of the different stages of the research. So the research we undertook went over a kind of whole year period. And as Joe was just explaining, first of all, we wanted to really understand what is out there in the kind of peer-reviewed public domain in terms of evidence base. So we started with a systematic literature review, and we set out our search criteria to really see this is what we are looking for to understand those risk factors to health and well-being in dentistry. And we found 358 studies originally, and then we went through a process of thorough screening. So we screened the titles, then the abstracts, and then the full review of the papers, and whittled it down to only really 15 papers being appropriate to answer the research questions that Joe just talked us through. So that is not a huge amount, and that is the 15 papers that we kind of reviewed thoroughly and are in the process of writing up the results paper. Following that, we had a series of interviews. So we spoke to 15 dentists across the world. So they were based in 6 different countries, and had an hour-long interview with people to really understand their experience of work and of work-related stress, pressures, and to understand about available resources and to what extent they might access those resources and if they're helping. And then the final stage of our project was to do a survey, so to reach yet a kind of wider audience. So 422 dentists took part in the survey, based in 24 countries. So
Wow.
that gave us more of a global picture of what dentists are experiencing.
That's fantastic. I'm glad that you were able to reach so many in that broader survey, because I know it can be very difficult sometimes to get people to respond to those things, particularly clinicians. And I think, in all fairness to dental practitioners, when we're at work, we've actually got our hands in people's mouths, which does make it a little bit difficult for us to respond to surveys, for example. And fascinating that so many of the papers had to be but that's so common, isn't it? So your results then, are there any results that you can share? But also, I'm really curious to know, were there any results that surprised you or perhaps challenged your expectations? Because I'm listening to you talking, and I think I've got a reasonable feel for what some of your findings will be. And I'm really curious to know, did they align with what you thought, or were there any big shocks? Or was it, tell me all about it.
Absolutely. So in terms of some of our key findings, as you say, some of them maybe not that surprising, especially with your experience of the dental profession and some of the things we know already. So the 2 key findings were, first of all, around workload, the high workload experienced by dentists, and the impact that has on the long hours that dental professionals end up working in order to see their patients, and then on top of that, having to do the admin responsibilities that, as you say, while you're at work, you have your hands in people's mouths, you don't have time to do the admin, leading to long hours. But also, dentists explain to us that it leads often to a lack of breaks. So the ability to take a lunch break or a rest break or have a little bit of time away from work. In addition, some of the dentists also spoke to us about waiting lists and the work pressure experienced by that knowledge that there are people waiting to be treated. And that, I guess, means that you're under more pressure to keep working and to fit in more patients to get to those people in need that are waiting for treatment. In addition to that, we also found the kind of patient relationships, or the perceived patient relationships, and the impact of that on the experience of well-being at work for dentists, both in a positive and in a negative way. In a positive way, a lot of dentists, both in the survey and in the interviews, described the energy they get from the relationships with their patients, with their community, with the work that they're able to do, the support that they're able to give, and those relationships really help with the kind of drive and the passion to do their work. On the other side, the pressure from patient relationships, possibly to do with the expectations from patients, high expectations, but also the anxiety experienced by some people, or possibly quite a lot of people, about going to see a dentist. The people I spoke to described how that puts pressure on the dentist. If you see person after person that comes in that doesn't really want to see you or is scared to see you, requires quite a lot of resilience, really, throughout a day or throughout a working week. So if we're looking at those two kind of key results, so the high workload combined with those high emotional demands, that has a real impact on dental well-being and the experience of work in dentistry. I don't know, Joe, if you'd like to add to that, or maybe talk a bit about the surprising findings that we found.
Thanks, Marleen. It's I suppose a surprising and also a key finding was also around how dental practitioners reported their access of services. So we found that actually only half of those dentists that we surveyed had access or thought they might have access. So lots of people weren't sure, and many people said that they didn't have access to support services. So given that high workload and the high emotional demands, it's absolutely a profession where support needs to be made available and also needs to be very clearly translated and accessed.
Can I ask, when you're taught, so I know what I think you mean by support services, but for our colleagues listening, can you just explain what you mean by support services or access to support services?
Absolutely. So there are a whole range of different things that we could mean. So thank you for flagging it. It could be access to a counsellor, to a therapist, to somebody with specialist knowledge that can help them manage difficult emotions, feelings, and presentations of mental health at one end. But it could also be awareness of what some of those key stresses are, and strategies in a pamphlet or access to an online hub around how to manage them. Being forearmed is forewarned is forearmed, isn't it? If you know what those challenges might be, you can start to make sense of them, and also it takes away that isolation that comes with, am I the only person that's experiencing this? And when we know that these are the factors that are important in work and that they impact others, we can then think about how we might want to change or talk about how these things are impacting us and change the way we do things in our practice or with our patients or with our community. So support can be anything from intensive one-to-one support, peer support groups, and also making knowledge and training available so that people have the resources and the know-how, the strategies, the skills to manage and cope with those demands, or indeed change the way they work. So it's a broad range of things, but what we heard was people didn't even know there was anything there.
Oh, that's a shame. So thank you. No, thank you for going through that. And for those MPS members and dental protection members listening, I do just want to emphasize that you do have access to a confidential counselling service as a benefit of your membership. And if you're not sure how to find that, if you hop onto your webpage for your region, the details should be there. And if they're not, if you call through to your local advisory line, then they will be able to put you in touch with that. Also, a number of the pages, for example, I can tell you that obviously we're on the Australian podcast series. The Australian webpage has a specific wellbeing hub, which contains several resources for our members in all sorts of different forms. So podcasts and articles and presentations, and we've got 2 apps that do different things. And so there's plus the access to the counselling service. Just so for any of our members who are listening, as benefit of your membership, we provide support of that for you. And then, of course, many other colleagues have access to other things. So in Australia, our actual regulator provides support too. So I just wanted to raise that because when you said people don't even know it's there, I just wanted to take this moment for our members who are listening to say, we've got you on this one. So thank you.
Really, thank you. And thank you for flagging it. And we hear so often in the work that we do across different sectors that people don't know that they have lots of things that are in place. And so just having that first glance and looking at them when you don't need them actually is really important, because as soon as you're at that point of need, lots of things feel overwhelming and it's really difficult to concentrate and find the right information that might be useful. So taking time to look at what's there when you're in a period of calm or when you're not experiencing stress or burnout is absolutely vital as well, because not only is that good for you, but you can then know what to refer and recommend to other people as well. So a real benefit in that. So I think that was one of our key surprises. But I think the other thing that really shone through was, as Marleen was talking about, there were many aspects about the way that work is designed and managed, organized, the way we do dentistry, that are challenging for dentists. And what that means is that no matter how many of these resources are available to help people cope with those challenges, unless we actually address the root causes and put in place strategies for those root causes of the problem, we're not going to be as well as we could be. So I think one of the things that challenged our expectations was there was very little that helped us really understand what those causes are and how people can take action on them. So how to take a preventative approach rather than just a reactive approach to cope with the accepted norms of the way that things are done. And so around that, I think there was a real call for further evidence, but also this this element that challenged our expectations in relation to the impact of the patient relationship. It was really wonderful to hear the positive experience that dentists got out of having good relationships, of making that difference. And it really showed the element of calling and vocation that comes with dentistry. One thing that's shone out, certainly I feel ashamed that I have never thought about this when I've gone to the dentist, is actually how is the dentist feeling themselves today? And I'm anxious, I'm presenting with this anxiety, and I know I've got to have a tooth out or a root canal, and I'm not the most pleasant myself because I know that I'm quite scared and I'm not really looking forward to it. But it really challenged me to think, actually, how do I turn up at the dentist? And how do I at least recognize that this is how I'm coming across and apologize for it, or put the dentist at ease and thank the dentist? Because that's, I think, something that perhaps I know I haven't done explicitly before. And maybe something around helping patients understand how their own reaction can impact others could be something that could be fostered and changed, as well as looking at other aspects of workload and so on. I certainly kept that in mind when I went to the dentist with my daughter the other day, and I thought, oh goodness, I know my daughter's not her best self today. And so let's dive into that situation and have a conversation, a human conversation with the dentist.
No, that's fantastic. That's so insightful of you, because I think I can't think of many other jobs where the first thing that people say to you is, I hate you, or if you hurt me, I'm going to hurt you. And that's one of the most common greetings you will get from patients who are strangers to you. And if people say that to you enough during the day, I have to say it gets really wearing. And I think I often feel that patients don't bring the best version of themselves. They bring a scared version of themselves, whether it be that they're frightened about the procedure or of pain, or the fear of the cost for a lot of people, particularly in Australia. We're having a cost of living crisis. I don't know if you're seeing that in the UK also, but people are worried about money, and dentistry is felt by patients to be an expensive distress purchase. They don't see it as being necessarily an essential item. So they're coming with all these fears. It's the equivalent of when I take my car to the garage and the man, because it's usually a man, starts telling me all these things. I don't know what he means, but he looks worried. And I know it's expensive. That's how people feel when they see us. I also wanted to pick up something that you said, Marleen. You talked about dental practitioners not taking a break. And this is something that I think is twofold in many ways, because I think that generally dental practitioners aren't necessarily good at recognizing they need to take a break during the day. So for example, just like a refreshment break, just to recharge. It's called lunch break. It's in the middle of our book marked as lunch, but many of our colleagues choose to use it as catch up on admin break, or, not actually to refresh their bodies, which is its intended purpose. But the other thing is that dental practitioners generally aren't great at taking holidays. And it's partly because if you take a holiday, not only does it cost you money, but you also don't have any money coming in. And then when you come back, you have this whole collection of patients who've been waiting for you with problems. So you tend to walk into some quite troubled waters. And we see that when practitioners are feeling vulnerable, if they're unwell, even, they will still continue to go to work rather than face the stress of those urgent emergent patients waiting for them when they return. So was that something that came across in your surveys, or does it just, what do you think?
Definitely. So I think, especially in the conversations we had, the interviews we had, um, the kind of difficulty taking breaks, as you say, not just short breaks in the day or a lunch break, but also having a day off or having a holiday. People also spoke about the knowledge that if you're not feeling 100%, but you could still go to work, then actually it'd be better to see your patients. You know that patients are waiting. You know that they need to be seen, rather than to take the time off, and it would, as you say, it would hurt your patients, and it would create a backlog of people that you then need to be seen in later days. And I think the other thing that leads into one of our other findings that maybe we weren't expecting so much is around having colleagues with you. And most dentists obviously work together in a practice with other colleagues. But a lot of people we spoke to, the colleagues are not fellow dentists. So in small practices, it's often a dentist working with a dental nurse or an admin support. Um, so if you think about other types of settings where people work, if you go on holiday or you have a break or you are off ill, one of your colleagues can take on your work and deal with the most urgent issues that need to be dealt with. Whereas the dentists we spoke to were very conscious that it was down to them to do the work, in practices where there aren't other dentists present. So we saw that was a real issue, and not just in order to look after work that you can't do, but also for that emotional support, that peer support, the opportunity to share some of the things that maybe you're struggling with, or that maybe you're not sure about, to have those peers kind of available on site. So that is definitely something that we would be interested in exploring further, the kind of availability of colleagues and peer support networks for dentists, which came out as a real important issue.
Isolation carries with it a huge number of risks, in all manner of levels. But the burden that you've discussed then, it's a huge burden to carry, and it really wears people down because they feel that they're responsible for everything. Terrifying. Also, just picking up on a point that you said then, and going back to something that you said, Joe, you mentioned about people pushing through when they're sick, which I absolutely know practitioners do. And it's there's actually been a beautiful New Zealand study called Superheroes Don't Take Sick Leave, which looks at the reasons why practitioners do work sick. And when you read it, it basically, every dental practitioner would go tick, 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 tick. But also going back to what you were saying about patients being anxious and your daughter not bringing the best version of herself to her dental appointment. How frightening do you think it is as a patient to think that not only are you nervous, but your dentist is working and they're not 100%? Because we all know on this call, and probably our colleagues listening will intuitively know, that practitioners who aren't 100% are more likely to make mistakes. So I think sometimes we need to think about in the terms of our patient safety. I know it can be really hard to take time off, and I'm a clinician myself, but we actually need to think about who we're helping and who we're hurting sometimes, I think. Now, another thing that Superheroes Don't Take Sick Leave picked up on was some gender issues in people and their behaviours. Did you find any gender issues or issues with age, or, I don't know, maybe regional variations? Were there any trends that you picked up on?
So in terms of the questions we wanted to ask, this was a really interesting research conundrum, actually, because as researchers, we wanted to ask everything. And our steering group were really helpful in making sure that we were pragmatic and being clear on what we were asking dental practitioners to respond to. And unfortunately, what that did mean, though, is that we had to make difficult decisions around the question sets. We had at one end a request for 10 questions in total, and on the other, knowing that research scales need to be lengthy sometimes to be robust and valid. And so unfortunately we didn't ask about gender. That was one of the demographics that was collectively decided to be taken out. But what we did find was actually no regional variations across those that responded from those many countries that
It's interesting.
at the beginning. And also when we looked at age, so burnout increased, as age increased, burnout decreased.
That doesn't surprise me.
I think often what we see in research is that there's a bit of a U shape, particularly around midlife when people are balancing young children and demands and so on. And that happens across different sectors. And then as people are reaching later career, making different choices, adapting work to meet needs and so on. So that might be something that explains it, but not something that we were able to really dive into with the data that we had in detail.
We're also seeing, really interestingly, more younger practitioners. So our recent grad cohort, which we would say is in the first 5 years post-grad. I mean, there's some research that would say it was in the first 7. I'm sure people don't think of themselves as a recent grad, even in the first 5 years. They probably think once they've done their first 12 months that they're no longer in that recent grad group. But it's interesting. We're seeing more of that recent grad group showing quite severe emotional distress in practice. And that is not something that we necessarily were seeing as much even 10 years ago. But I think it's tough out there. And I think you probably picked that up on your survey. You're both nodding. It's tough out there at present. Did you want to add anything to that, Marleen?
I was just thinking about a conversation I had, a few conversations with younger dentists, as well as some with dentists that had been in dentistry for longer and were older and maybe closer to kind of the latter part of their career. And just thinking there is a real opportunity there for sharing support. And the kind of more newly qualified dentists explained that in their educational programs there had been lectures on mental health and well-being, but to then apply it in practice when you're under pressure, when you are needing to establish yourself, when you want to create a client base or maybe your own practice, is really difficult. And I think there is a real opportunity there for whether it's mentoring or sharing experiences or some sort of support across the ages and the kind of the length in service, as it were.
It's we're seeing a breakdown, as it were, in the mentor-mentee relationships. It used to be something. So I graduated last century, and we all got a mentor. Whereas these days, it seems to be much harder. And a lot of younger practitioners report that mentoring is something which is hard to come by, just generally in their clinical skills, let alone expanding. And I think perhaps some of the behaviors, so for example, taking time off, would be to some older practitioners perhaps completely this offensive or not something that they would ever consider would be a reasonable thing to do. So they wouldn't necessarily recognize that young practitioner was being safe. They might just think they were being lazy. I know when I had my babies, I had one of those children that cried 48 hours a day trying to set a world record. And I'd be up all night with them, and I'd have to come in then to work, and I'd be driving into work thinking, I don't want tired me doing this surgical procedure on me. It's a terrible, terrible idea. And so I'd ring up from the car on the Bluetooth, normally in tears, like the completely responsible, put together professional I was, and just say, can you please just take these things out of my book? Because I really don't think that I am the best person to be doing that surgical wisdom tooth extraction today. I'm wobbly. I'm really, really wobbly. And my staff were amazing, and they would take care of that. And the other dentist would see some of those more complex things, and I'd see some of their patients. And I used to berate myself about it all the way to work, all day, and then all the way home, and feel like I was stupid and I was weak and I was letting everybody down. And it's only with distance and becoming more aware of this nature of work and the type of research that you're discussing that I've come to realize that actually I was being really sensible and really safe. And I would say to anybody who is in the same situation as me, if you've not slept, sweetheart, you really need to think about whether you need to be picking up that scalpel. But at the time, I think maybe a little bit conditioned to think that it wasn't appropriate to not be there for my patients. Interesting, isn't it?
I think building on that, also there are two things that are just springing to mind. So what we know from absence research and return to work research that we've done is actually it's those people that create boundaries and are really clear and protective of their boundaries, of time, of rest breaks, of saying that actually today I need to rest, I can't come in. They're the people that sustain work for the long term. And so I think there is something around building that understanding into our day-to-day approach to just living well. But also I think there's something that as a society, we know we've got aging populations in many countries. With aging comes multiple conditions and long-term conditions, chronic health conditions. And so you talked about your experience of being a parent with a young child, and as you mentioned it, I had some moments that really resonated with my eldest. But also we know that through our life we have periods where we're not well, and whether that
Yeah,
be
absolutely.
serious condition like cancer, a chronic condition that is fluctuating like mental ill health or diabetes. These are things that you can work with and you can sustain work, but actually some days you might not be your best self and you might need to take different duties. And I think having a conversation around that and a system that allows us to flex to our abilities day to day and our capacity day to day is going to be one that will serve us in the long run. So there is that element about age, there is that element about life experience, but also just broadly, we need to think differently about the way that we manage our work, because as older people, we're going to need to have that flexibility if we need to work longer as well.
Yeah, and that would be really powerful, wouldn't it? But listening to you talk, I'm then thinking back to our isolated practitioners and how they would manage that, because I work in a practice with 10 practitioners. So I'm in a completely different position to one of our colleagues who, I think it was Marleen, you described somebody and it's just them with their administrator and their dental assistant. How would they build that in? It's an interesting challenge, isn't it? Yeah, definitely. So one thing that when I read your document that came across is, and I think from our discussions thus far also, is it seems that the organisational support for many private practitioners in particular is really quite lacking. So based on your findings and your knowledge, what would your call to action be for organisations, do you think?
So I think there are several, aren't there? I think organizations and also the profession and those that are involved in the profession. I think number one, we need a stronger evidence base that looks over time. So the longitudinal evidence base. And with that, that's an investment in research from those that are able to fund, but also participation in research from those organizations that are employing dental professionals and also dental professionals themselves, which I know is always hard to find the time for research. But unless we do, we won't get the answers that we need to really make the difference. And until we do, we just have sticking plaster solutions, and that's not going to be good in the long run. So I think that's the first thing. And then encouraging better, different, more awareness of the available support services that are there. And then one of the things that Marleen and I were talking about, which really resonates with what you were saying about the younger professionals coming in and those entering the profession, is actually embedding those core skills in education programs to help them understand, these are the different things that may come up for you. This is how you can manage your emotions, but also these are the ways that you could maybe think about reorganizing work, and these are the words and the phrases and the language that you can use to describe some of the problems that you're experiencing, so that people have the tools to make a difference in their own work lives. So I think those are some of the things that we've seen work in other professions as well. And so thinking about how they can be translated into organizations for dental professionals is really key. And Marleen, I don't know if you want to talk about the different interventions. I know, Annalene, you mentioned a couple of interventions that are available to professionals on the MPS sites, which is brilliant. But actually what we know, compared to many other other organisations, there's not so much choice within the dental professionals. So thinking about how we can look at building more choice, more availability to different interventions is really key. And I don't know, Marleen, if you want to talk to that, because we've got an exciting new project that we're going to be building on as well.
Yes, thank you. Definitely. So based on the research we have done and the conversations we've had with the MPS Foundation, the MPS Foundation has agreed to fund a further study where we're going to be working in a co-design setup. So we'll have a group of people consisting of dental professionals, academics in the area of health psychology, organizational psychology, and experts in the field in terms of intervention design and kind of smaller organizational setup and looking at wellbeing support. So we're going to be working in that co-design methodology to design a preventative intervention for supporting the mental health and well-being of dentists, with the idea that being able to offer support that is designed by dentists, specifically for dentists, looking at those risk factors that we found, hopefully we'll be able to offer a tailored approach. So over the next 6 months or so, we shall be working on this through a series of workshops. We'll be putting together a toolkit type intervention that looks at prevention, but that is tailored to dental professionals, with the vision to then trial that in a further kind of research to kind of make sure that really this is addressing some of the issues that dentists have shared with us. So once this is all kind of set up and we're in the early stages, we would be most happy to share information about it through your channels, so that if people would like to take part or contribute evidence or just keep up to date with where we are, they know where to come to.
That'd be amazing. And that sounds amazing and really, really exciting. I think even just going back to what you were saying, Joe, about the education piece, I think even being able to name how you feel can be really difficult for some practitioners. Even before you start, it can be difficult to recognize how you feel, let alone why you feel that way. So the idea of developing something that's tailor-made for an intervention, I think sounds fantastic. And I wish it had been around when I was a baby dentist, but it wasn't. So finally, then, we're talking, of course, about your research project, Thrive at Work. I will put some links in the speaker's notes to an article about this and also to the Foundation webpage for anyone who's interested in looking at your research, in looking at the other research projects which are going on under Foundation all the time, or perhaps even looking to become a Foundation researcher and get some funding for your research. So I'll put all that in the speaker notes. But thinking about thriving at work, what steps, obviously knowing something's coming, what steps do you think a practitioner like me can take right now, tomorrow, in response to the insights that you found from your research? What can I do tomorrow to better protect my wellness and mental health and thrive at work?
Shall I kick off?
Yeah.
So that's such a good question, and I'm sure at the forefront of people's minds, the research is really important. But what can people do, kind of here and now?
Yeah.
And I guess there are a few things that that people dental professionals can keep in mind. First of all, is to really develop and share that awareness of one's own well-being. How do I feel when I'm feeling well? How do I feel when I'm not feeling well? What are my kind of signs and signals that indicate how I'm doing? And also, how can I embed that in my practice, my immediate environment, where we look out for each other and look out for signs and signals that maybe somebody needs a short break, maybe somebody needs a longer break, maybe somebody needs some signposting to some of that help and support that is available and that is out there. I guess that leads to the second point of having that more of a kind of open communication conversation around mental health and well-being, and something that you're doing very much on this podcast, creating more of a kind of open conversation around health and well-being, and reducing some of that stigma and inviting yourself and others to be able to share if and when that is helpful. And to create an awareness, I guess, for yourself and with colleagues of what the resources are that are available. So you've signposted to the MPS Foundation resources, or the resources available within Australia. So anyone who listens within their local area or their geographical area, there will be resources available, and it will be really helpful at a time when you're feeling well, to build an awareness of what those resources are, and to share that with colleagues, so that when the point comes where you might need them, when you're not feeling so well, you already know where to find them. Jo, I don't know if you'd like to add something to that. Any other thoughts?
Yeah, I was just thinking, I often think in terms of what can I do for myself and my personal well-being, and what can I do with my work, and that big cluster of things that may be driving some of my ill health behaviors or my bad habits, or actually affecting the way I feel. And I suppose one of the things that we talk about a lot in the UK is our 5 ways of well-being. So actually,
Okay.
am I building up my resources, my own work resources? So am I looking after myself in a way that gives me the best chance to optimize myself? So do I take notice of what's around me? Do I look up from my phone? Do I actually just be present in the moment? And for some people, they need to engage in mindfulness, or a program that will help them embed that. Others just like to go for a walk and maybe look up and look at the leaves and get that nature. Another is about movement. So am I moving my body and making sure that, with dentistry, there is a lot of static movement. There is movement, but there's a different kind of movement when you go for a walk, or a brisk walk up to the shop, or whether it's is actually going and doing some exercise, or just dancing in the kitchen while you're making dinner. Some movement that gets you going. So there are little things that we can do that are around our basic needs, our social needs in terms of connecting with friends and so on. So making sure that you're doing those basics, but also on the work hand, are there some things that are getting in the way regularly that are affecting the way you're doing your job? And is there one small thing that you could change or talk to your colleagues about changing that would actually make a big difference? And often we think that these changes that need to be made are huge. How do we reduce the waiting lists? How do we make sure that patients are going to come and be civil to us? Those are really big things, and we can't always change those right away, but we can make little changes to the way we do things, which might be about having an agreement that we do take a rest, and we all go for a lunch break, or we all take 15 minutes where we don't look at our phones over lunch. So we're recuperating, and we're really restoring ourselves. Little changes can make a really big difference.
No, absolutely. That's great advice. Thank you both. So before we part then, are there any final words that you would like to say? Any other information you would like to impart?
I think we've covered so much, haven't we? Thank you so much for having us, and it's been brilliant to be able to share our research. And thank you so much to the MPS Foundation for funding this really, really important and interesting research that I hope will really make a difference as time goes on. It feels like it's the starting point of gathering energy to really make a difference with the work that you've been doing, and others in this space. It feels a really good time to be taking a preventative and shift changing.
No, absolutely. And thank you for undertaking the research. And the foundation is absolutely there to support. For those of you who are interested, like I say, hop on the foundation webpage and you'll see the nature and type of research that we're supporting. But as we've been long saying, MPS and dental protection take your mental and emotional well-being very, very seriously. And we're absolutely here to support you. And this is just another way in which we're hoping to support the profession so we can all be safer and happier. And wouldn't that be wonderful? So thank you both for your time and for that helpful and interesting content. And of course, thank you all for listening. And I really hope that this podcast has been helpful to you. And we look forward to sharing more guidance with you in the future. And in fact, I'll probably be having another chat with Jo and Marleen by the sounds of it. So if you like Dental Protection podcasts and you'd like to hear more, please subscribe and leave a review. Thanks.